Welcome to Your Health Matters. I'm your host, Temesia Tuicaumia, and tonight we have a very special guest, also from the Ministry of Health. I know we've had quite a few national coordinators come in, but today we have a very special one because she's talking about RHD, rheumatic heart disease, and this is a raising concern in Fiji. Hello, Vere. How are you?
Hello, Temesia. Thanks for the invitation.
Thank you for coming. I really like your dress. I know you just bought it, and can you tell us why you picked a red dress?
Rheumatic heart disease, we always advocate for outreaches for people to come early, and red is like just a color
That's your
for
color.
the program,
Yeah.
so that's why I picked red.
Oh, you're very passionate about the work you do.
Yes, very much.
Okay, now, national coordinator. That sounds like a very, what's the word? Stressful title in a way, but very blessed, but can, take on a lot, being a national coordinator. What is it like being a national coordinator?
So for me, coming to this role, just started in October last year, so going on to the...
Oh, congratulations.
Yes, so this is like my 6th month into the program, but a lot of learning and a lot of, trying to coordinate the teams that has been there on the ground.
Yeah.
This post was vacant for about 10 years.
Wow.
So coming back, trying to get the teams together. But
Awesome.
it's been a learning experience for me as well.
Well, congratulations. I know you'll do a great job as the national coordinator. Okay, so for our amazing viewers at home, rheumatic heart disease. Vere, could you please enlighten us? Oh, and by the way, Vere is a nurse by profession, and now she's taken on this role as a national coordinator. So Vere, please enlighten us, what is rheumatic heart disease?
Okay, rheumatic heart disease, maybe some of you must have heard it already over the radio, or when you go to schools, you'll hear or you'll see that the teams are out there doing screening, echo screening. So rheumatic heart disease is actually an infection of the heart, So when we go out to the communities, most of the time we tend to ponder more on rheumatic heart disease rather than actually looking at acute rheumatic fever.
Right.
So acute rheumatic fever, the complication of it is actually rheumatic heart disease.
Wow.
That is when part of the heart, which is called the valve, it acts like a door for the heart.
Okay.
So when the valve is not working properly, that door of the heart cannot close properly. So there tend to be a backflow of blood, which also affects children's performance. And, when the heart is infected, which actually slows down the performance of our children.
I see.
But we always try and emphasize to the parents, before it gets to that stage of rheumatic heart disease, they must bring their children forward to be screened, where we can actually provide treatment, provide more support for the parents. That is at the acute stages. So that can also be treatable before it advances. So with rheumatic heart disease, basically it's just that infection of the heart when it is not able to open and close properly, so this backflow of blood. Some parents are not aware of this, but we are doing our best to reach out to the communities. And
I really like your explanation of the rheumatic heart, and then you talked about acute. And the door. And because from acute, then it becomes a rheumatic heart disease? Wow.
But from that stage of acute rheumatic fever, some of the signs that the parents can also pick up is when their children have sore throat. Or
oh my goodness.
Yes.
Okay, so this is like really important in terms of, it's very important, but these are things that sometimes you take for granted, like, oh, just calm down. You don't really have a sore throat. Stop being dramatic. Wow.
But we encourage the parents, don't just go and, if they are seen by the doctors and they are not satisfied with the treatment, they can always question or ask the nurse or the doctor, can you just have a look at my child's throat? And so they'll be able to pick up if
from that they can see if it's connected to the heart.
and
Wow.
also having that early referral. So even if they're not satisfied with the treatment, they can always
Yes.
refer. We have our specialists in the hospitals who do echo screening.
When you say in the hospitals, is this the three main ones that we have? Like
Yes.
in Lambasa?
Lambasa, we have CWM in
CWM?
Suva and Lautoka Aspen, but we
Okay.
also have Cyprema Hospital.
Oh, Cyprema.
Yes.
Oh, and for those of you at home that were watching, we had Dr. Krupali here, and
Yes.
she shared a lot about this. So remember, it's free over there,
Yes.
and it's also free
Yes.
with our...
And our teams are always going out. There are also requests from the subdivisions whereby
Yeah.
we coordinate from national level for the teams to go and conduct
Wow.
community screening. Yeah.
So this is a really important
Yes.
message for our moms and dads, because sometimes moms and dads are not trained
Yes.
well to pick it up, and I like what you said
so
too.
apart from sore throat,
Yes.
there can be swollen joints as well.
So like
there
around
can be some
here,
fever going
fevers
on,
as well.
even jerky movements.
Yes.
So if parents notice that their children are having sort of, some sort of movements which are not normal, they have to bring them to the nearest facility that is
Yes.
closest to them.
For a checkup.
Sometimes we tend to, just say,
Brush
oh,
it
it's just a
aside.
minor
Yes.
illness. So
This one is
it's
always
so
active,
common,
always
yeah.
running.
Yes.
That's normal. It's
Yeah.
not normal. And I like what you said, for moms and dads, that to question, if
Yes.
they're not happy with the results, to keep asking, can you
Yes.
please check this? Can you check this? I think that's important, because
Yes.
sometimes we just go, no, the doctor knows everything, and
Yes.
that's it. I mean,
Yes.
the doctors
Especially
are human
in our
as well.
rural communities.
Communities, do you feel like
Yes.
there's a big
We
need
have
out there?
cases also coming in from the peripheries, but recently we have seen an increase of cases. That's also because of the increase in the number of outreach screenings. So
Fantastic.
before, most of the cases just come
Communities
into
are
the
more
yeah.
well aware.
Yes.
Just before we go to a break, Veri, do you mind just sharing with us among young children and young people in Fiji, how many are we looking at that have rheumatic heart disease or are in that process of being taken? Yeah.
Yeah. So for us, our main target population are those from 5 years to
Yes.
15 years.
Okay.
And we have also seen an increase in class 6 children. So with our school teams, they focus mainly on these year 6 students. We have our school nurses and also our specialists going to the schools, because with the increase of school students, we have also seen the increase in cases being detected by our teams. By analyzing the data, there is a high prevalence of year 6 students, but that does not limit, if parents have children who are less than year 6, who are in ECE to year 5, or above year 6, they can always request our nurses and our specialists for screening.
I love that. Thank you,
But
Veri.
with our current situation here in Fiji, we have about 4,500 cases.
4,500 cases at this point.
Yes, we continue to receive new cases, like for last year alone in Kandavu.
Yes.
Cyprema team managed to pick up 53 new cases, and the same with Yasawa.
Wow.
During the Yasawa tour, the school team also picked up 53 new cases.
That's amazing.
But there's another issue, like with the referral of these cases to the main hospitals or to Cyprema.
Okay.
Some of them, they cannot make it to the main facility. So we're trying our best to reach out.
Wow, well, thank you, Veri. It's been interesting already listening to you about all this, but I'd like to talk more about these cases and where they are. I hope you've been enjoying just our first bit and our Talanoa with Veri and rheumatic heart disease. Go make a coffee, and I'll see you right after the break on Your Health Matters. Welcome back to Your Health Matters. I'm your host, Temesia Tuicaumia, and tonight we have Veri, the National Coordinator for Rheumatic Heart Disease. Whoa, Very, you've thrown some numbers already at me, and I'm just like, wow. Do you mind just refreshing us again on that Yasawa and that 4,500
yes.
cases?
We have seen an increase in the number of cases coming in, like for Yasawa, for our outreach last year. We
Everybody in
managed to pick up
Yasawa, Bula.
53 new cases.
53 new cases. So
in
what can Yasawa do at this point?
Yes, so
As a
for them, we'll be going again this year, supporting their school
Amazing.
team. We
Reaching
already
out
have
to
Kiwa
them.
kids who have also agreed to
and there's medical
support the team.
services out there as well
Yes, we have our
in the
nursing
Yasawas?
stations
Oh, that's
and
cool.
our
So
health centers.
in Yasawa, they can
Yes,
go
they can
and
go
get
to the
checked
nearest
there.
health center that is available.
That's
Yes,
awesome.
yeah.
So just recognizing and preventing rheumatic heart
Yes.
disease. I know you've touched a bit on the recognizing, but maybe it'd be best to share it again with all our moms and dads at home and guardians, just how they can recognize, and then what are ways that we can prevent it. Quick question. When children get sick regularly, can that
Yes.
also...
Yes,
Oh,
yes.
okay.
So when any child gets
Yes.
sick, it keeps their parents worried and,
It
keeps
does.
them on their toes. So they'll be worried about what is actually wrong with my child. So sometimes if they're going back and forth to the health facility
have
and
to
they're not
question
sure,
that, right?
back of their mind, they should be thinking, can it be acute rheumatic fever? Can it be rheumatic
I love that.
heart
It has to
disease?
be a question that's
Yes,
always in the back of your
yes,
mind.
Yeah.
Wow.
And we have trained staff across the country to actually identify these symptoms early and have them referred to the nearest divisional hospital.
So that means
yes.
all these medical centers around
Yes.
Fiji, the doctors, the nurses, have some sort of training on
Yes.
rheumatic heart
Yeah.
disease and then refer them is it
to the
Cyprema
divisional
or
hospital.
divisional
Yes.
hospital?
So for Western
Awesome.
Division, we have Aspen Hospital
Okay.
there. Our pediatrics team are
This
very
is in
good.
Lautoka?
Yes, in
Okay,
Lautoka.
so those of you based out there in the West, make sure to
Yes.
go to Lautoka Aspen. You can get
Yes.
checkups there. And what
And
did you
in
say?
the north,
In the
we
north?
have Lambasa Hospital
Lambasa
there.
Hospital is for everybody in
and also
the north.
CWF for
And
us
CW.
in Suva.
How about those in the maritime that are in the Eastern Division? Do they just go to their medical
Yes,
center?
they can go to
Then
the
they come
nearest
to
health
CWM?
center, and if the medical officers or the nurse practitioners or even the nurses out in the districts, like in
Yes.
the nursing stations, so if they pick up that this patient or this child can have acute rheumatic fever or rheumatic heart disease, there's no harm in actually referring them to the nearest hospital.
That's amazing.
Divisional hospital.
Okay,
yes.
Very. What are some ways that moms and dads and guardians at home can prevent their children from getting too acute
Rheumatic fever.
rheumatic fevers, acute rheumatic fevers, and then also prevent them to getting rheumatic heart disease?
Okay. At home, we encourage parents to continue to advise their children on proper hand washing techniques, even eating healthy meals, and also like if there's any problem for them to also inform their parents, because sometimes when there's also late referral or late detection, it also
Yes.
prolongs the process. Sometimes when they come in
Yes.
at the severe stages, there's nothing much we can do. But if our specialists are able to detect that,
Earlier.
that there are operations available,
Yes.
we have Cyprema team that is here, and we are privileged to have these services here
Yeah.
in Fiji.
So they
Before
collaborate
we used
with
to-
the
yes, with the Ministry of Health. Yeah.
Awesome.
Before Cyprema was established, we used to send cases across, which was really costly for them and also for the ministry.
Yes. Is there any other non-government organizations or civil society organizations that you work with?
We have Kiwa Kids who have also been very supportive.
Oh, Kiwa
Before I
Kids.
came
Yeah.
in, so they were doing majority of the work in,
That's
with
awesome.
rheumatic heart disease.
Yes.
Also doing a lot of researches, which also supports the program in terms of reaching out to the communities to do echo screening. I understand that they have piloted in the Western and also in Lambasa in Nausori. Nosori, Suva, and also in Lambasa.
Wow.
Yeah, so they have trained these nurses and also some doctors who continue to carry out this screening
Yeah.
and make sure that these children are well looked after or able to get the treatment before any complications arise.
Wow.
Yeah.
Okay, so now we've talked about how you can recognize it, then preventing it, and then for say you find a case, what is the treatment like from there for someone with acute
rheumatic fever.
Rheumatic fever and also the rheumatic heart disease?
Okay. For acute rheumatic fever, when we're able to pick up that case that has acute rheumatic fever, it depends on the age as well, on how we are able to implement the treatment.
Okay.
So
is it like medication or?
Yes, they have injections. It's called a benzathine penicillin G injection.
Wow.
So this is given to this.
Is this?
Yes, this is the card they usually bring.
That is so cool.
So, for
every
our cases,
patient
every patient that is diagnosed, acute
fever?
rheumatic fever or rheumatic heart disease, we usually give this card to them.
Okay.
But we also believe that proper, providing the parents with the right information that will help them to be supportive to their children to comply with the treatment. Because getting monthly injection for anyone, it's a bit painful.
It sounds
but
like
we
it.
also have to explain to them that this is important, so it will keep their heart strong.
Oh, so they need that injection to keep their heart strong.
Yes.
And they have to do it every day, every month of their lives?
Every month, yes.
Until they grow old?
Acute rheumatic fever, we encourage them to stay on treatment for about 10 years because there's also a high risk that they will also relapse. So in case like they continue for a few years and then they leave the treatment and there can be complications. So for acute rheumatic fever, it can advance to borderline rheumatic heart disease that can also advance to mild rheumatic heart disease. So you have borderline, mild, moderate, and severe.
Whoa.
Yeah.
Well, Vera, that's a lot. I think we need to break it down more right after the break. I hope you've been enjoying Vera, the National Coordinator for Rheumatic Heart Disease, sharing with us the work she does on rheumatic heart disease and also acute rheumatic fever. We'll be right back after the break on Your Health Matters. Welcome back to Your Health Matters. I'm your host, Temesia Tuicaumia, and we have Vera, the National Coordinator for Rheumatic Heart Disease, here with us tonight. Vera, it's been such an enlightening conversation. These are things you go past and you hear, oh, that one has rheumatic heart disease, oh, that one has acute rheumatic fever, and we're not well educated, or there's not enough awareness. So it's really nice to hear the work that you're doing across our country to supporting so many children. Oh my goodness. Okay, now talking about children, what's it like, community and school outreaches for you?
For us, the prevalence for rheumatic heart disease, it has been 1 in every classroom. So,
that's a really good way to say it. 1 in every classroom has rheumatic heart disease.
But with our screenings that has been ongoing, we also detecting more than just 1 from
so it looks
each
like
classroom.
From your recent data research, you're looking at maybe more than 1 now, eh?
Looking at more than 1.
We look forward to seeing that data come out soon.
Yes, and with the school teams, we have the team in Lambasa who has also been covering the northern schools. We have our teams here in Suva and Nosori, and also those in the Western Division. And we also work closely with the teachers, so the teachers are aware
all the school
that,
teachers.
that this particular child in their classroom has rheumatic heart disease.
So they're always looking out for symptoms, like, okay, this
so
one needs a
sometimes
check.
they'll be, coming into school, maybe feeling a bit weak. There's a bit of this slight
I love
pain.
that. It really does take a team. It takes a village to raise a child. So having the teacher, mom, dad, your nurses that are out there, the doctors, everybody plays a strong role here.
So we have the school teams. They also go to schools. So if they pick up any child that is, defaulting their injections, they take the medications there with them, and they also.
Okay. So apart from injections, you can take the what do you call it? Like just tablets? Yeah,
the tablets are mostly for those who are allergic to the penicillin injection.
Oh, I see.
We are giving the Benza injection. So for those who are allergic to the penicillin, they take erythromycin tablets.
Okay.
And we also have some children who have also undergone surgery, but they continue, like most of them, they come back. Some think, when you have acute rheumatic fever or rheumatic heart disease, you are not able to go out and play with the other, with your other colleagues.
That's a very good point, because I feel like if a mom or a dad was to find out their child had either a rheumatic, acute rheumatic fever, or rheumatic heart disease, right away it's like, stay inside, you're very sick.
But we're very thankful to Heart Heroes. We have Heart Heroes Fiji. This is actually our first patient-led organization, which has been formally established last year. So this involves
people
these are our Heart Heroes, our Heart Champions, those who actually live with RHD. So when we go out to the communities or to the schools, they support us in terms of education and awareness. Cool. And that, when they share to the parents or to the students themselves, to the patients, it tends to offload that.
It does, because it's like, I would be scared too, if someone said like, if you have sore throat, right, oh my gosh, I have acute, rheumatic fever. But it's good that you have this Heart Heroes. Yes,
we have the Heart Heroes. They've been very helpful, going around to all the divisions. They just came back from Boa with our outreach team in the north, led by our Northern RHD coordinator.
Awesome.
And yes, they'll be joining us again with our Levuka outreach.
Oh, that is so cool.
And on that note, we also have Levuka coming up the week on the 13th.
Yes.
So we're expecting a lot of mothers, a lot of daughters that we will also be screening. Yes.
Okay, we've talked about the community now and the Heart Heroes. Is there any message for our community leaders? Because it sounds like they play a strong role, especially our chiefs out there, those that live in settlements and have community leaders. What's a strong message for them as well? How can they get behind their community and speak to the parents in the community to take their children in for these regular checkups?
Thank you, Temesia, for our community leaders. You all have an important role to play.
They
so, trying to get this across to the children, to the community. So if there are cases that are not coming in, we're trying to locate them. They can assist us with that. Even if their community members move from one place to the other and they are aware, they can always reach out and inform us. We also have the community health workers out there in the communities. They're very helpful when it comes to tracing our defaulters. So they know exactly, okay, if I'll say Temesia is not coming to the clinic, so they know where they are located and they can always trace. Sorry, I'm just using that for an example.
That's good. So that's for all our families out there. And you're trying to sneak around, they will find you.
But goes back to the early detection.
Yeah, early detection is very important. But thank you for giving those concrete examples, especially for our communities out there that need this. Looking ahead, what is the ministry planning to do? And I know you've just taken on this role last year in October. Is that right, Barry?
Yes.
What are you looking forward to? I know you've mentioned a bit of your outreaches that you're going to be doing,
Yes.
but what can the
When I
communities
came
look
into
forward to?
when I came into the service,
Yeah.
one of the main targets for us to review the policy. So we're also
Oh.
looking at streamlining the process, having this acute rheumatic fever, or rheumatic heart disease cases to be included in our special outpatient department clinics.
Okay.
So they come through SOPD clinics, have them checked by the triage nurse and also by the doctor. If they are due for their oral examination,
Yes.
they'll go to the dentist for their
Yes.
oral health checks, and
Yes.
also with the echoes.
Right.
If they are due for echo, they will also be referred accordingly. We also encourage those in the communities, like it's not only with dental caries and the other problems, even those who have some skin infections.
Right.
Like in our communities, especially those in the rural communities,
our
when they
maritime
have some
communities.
skin infections,
Yes.
they tend to
Come
just
in
take
for
it,
checkup. Take it
take
lightly.
it lightly.
Like, oh, that's from,
But
Bunokata
little do
or
they
whatnot.
know when those
Yeah.
skin infections become infected,
They do.
like with infected scabies, that can also directly link to this rheumatic heart disease.
Wow.
It's the streptococcal type A bacteria.
Wow.
That is the main culprit for
Yes,
this
that bacteria
acute
is the one once it
rheumatic
gets
fever.
in.
And it gets
Washing
in
hands
through,
is very
yes,
important for all our
Yes.
little children that are listening right
Yeah.
now.
So we encourage them
Yeah.
to, have them checked, be
Yes.
given the right treatment. So
Yes.
yeah, having reviewed the policy, we're going to increase and expand our screening
That's
programs.
fantastic.
We also will try and strengthen the follow-up of these cases.
Yes.
So if we detect any case in the community or in school,
Yes.
we'll make sure that they are followed up. If they cannot come to the facility, to the confirmatory facility where they're doing our echoes, we can provide service
Mobile
when we go
service.
for our outreaches.
Wow. Very, it's
Yes.
been really, really good talking to you, and I've really learned a lot about acute rheumatic fever and also rheumatic heart disease. So thank you so much for your
Yes.
service.
Thank you for having me
it's not
here.
an easy job to do, Vere. So thank you for doing what you do, and I can
you.
hear your passion for the work you do. So I'm really excited to see you very soon and see how the policy is going and
Yes.
the outer outreaches. But Vere, before you go, a lot of moms, a lot of dads are watching right now, and if you could just take a moment to really speak to them, and also the guardians, our bumbus, ajis, tukais, everyone that's at home, our cousins that are watching, what's a good message that you'd like to just share with them so that they take this seriously, and that the services are there and it's free, and also not having that fear?
I believe the main message, what Ministry of Health always preach out to the public, that prevention is always better than
Awesome.
cure. If you are
Good.
able to prevent
Yes.
these children from getting all these infections, skin infections, whether it's dental caries, we have the responsibility
We do.
to help them. They're just small and they're growing up, but for parents to be also role models to them, like they'll see what we do as adults, and having them referred or to be checked early.
Good.
So we're able to provide treatment on time and support our children where they will continue to go through education and be successful in life.
Thank you. Well, that's it for us tonight on Your Health Matters. I hope you've enjoyed tonight's episode. Make sure to catch us next week, same time right here on MaiTV.